Afternoon. Good afternoon. It's 5:02. I'll call emergency meeting of the Lubbock City Council to order. Today is Monday, the 16th of March, 2020. Thank you, council, staff, and citizens. Thank you for joining us on very short notice. Our agenda tonight is pretty focused and relatively short. As is our custom, we are based on our council rules. We will start with citizen comments. Citizen comments are any citizen that signs up before 5 o'clock or shows up before 5 o'clock, signs up to speak to something that's on the agenda that evening, completes a form, and then we'll call you up individually. You have 3 minutes to offer your comments. We'd like you, when you come up, to state your name and address. We want to read that into the record. We like to hear original thought. I know that we'll have, we don't want to hear the same thing over and over. We also ask that you refrain from clapping or hissing or booing. The acoustics in this room are not particularly good, and we're not particularly young, and so that's sort of our something that we sort of our practice. So we have a number of citizens that have come tonight to express their concerns about the item that we're considering tonight. There's 2 items, but they're certainly very much related. So we'll start with David Sia. David is here to talk about that item. David, please come forward.
Thank you, Mayor Pope and City Council. I appreciate your time. Basically, I'm just here as a restaurateur, a member of the...
Name and address, please, David, before
I'm sorry.
we get started. Let's go.
5217 82nd Street, number 109, Lubbock, Texas, 79423. Co-owner, operator of Orlando's and Caprock Cafe here in town. I just wanted to reassure the City Council that as a local restaurateur, a member of the Lubbock Restaurant Association, a member of the Texas Restaurant Association State Board, that the restaurant industry in Lubbock is willing to do whatever it takes to keep our patrons safe. Whatever we have to do to make it safer for our customers to come in, we're willing to do. What we cannot do is close our doors. That would devastate our industry, and it will devastate the income of our employees. So I appreciate your consideration on that. Thank you.
Thank you, Mr. Sia. Next this evening is David Deason. Mr. Deason?
Mr. C has pretty well stated our position. Thank you.
Thank you, Mr. Deason. Next is Brenton. Sorry, Brenton, I'm having a hard time with your last name. I'll let you say it again when you come up here. Thanks for being here. If you'd state your name and your address, please, sir.
Brenton Onofre, Lubbock, Texas, 4716 61st Street, 79414. I'm just here in question to the press conference that was held by the president. It was going simultaneously with the press conference that was occurring here in Lubbock. The CDC recommendations went from, in a matter of days, from a gathering of 250 to 50, and then at 5 o'clock, gathering of 10. With all the medical professionals in the United States, around the world, including Dr. Fauci, the director of National Institute of Allergy and Infectious Disease with the United States, who's lived through 40 years of pandemic and has worked with the Ebola pandemic as well. He's making these recommendations of groups no larger than 10 to gather. I think all the medical professions that we've listened to, that we've read, the research that we've been given has shown that social distancing is the #1 way to stop this pandemic. And also, I believe the White House called on millennials to be the driving force. We're the ones that socialize and gather in those areas the most. We're the ones that are most likely to, even though we may not be symptomatic or have mild symptoms, we're the ones that are most likely to pass those on to people that it can affect greater than ourselves. So my concern was the gathering by Lubbock, the city of Lubbock, of allowing 200 people in those gatherings as opposed to the 50 or 10 that are recommended by the CDC. I know there's no confirmed cases in Lubbock, does not mean that there aren't any cases in Lubbock. We just don't know of them. Also, the medical professionals have also urged us to get ahead. Dr. Fauci himself said it may seem like an overreaction now, but it's only an overreaction because we don't know where we are. And when it's said and done, it will not be considered an overreaction, but was the appropriate steps for us to take. So my concern is Lubbock considering on reducing that number? And if not now, at what point would they consider to do that? And lastly, I would like to thank all of y'all and your and the healthcare profession leaders for your leadership. And I think Lubbock's been mightily proactive in setting up and keeping the citizens informed. So we appreciate that. It's greatly appreciated. And then lastly, if you don't know about Patient 31, that may be something to look into. South Korea, Patient 31, they had it under control until Patient 31, one person, went to a gathering of 1,000 people, went to a gathering of 16,000 people, and the situation escalated quickly. Thank you.
Thank you, Mr. Onofre.
Additionally, I'm a small business owner in town too, and I service the restaurant industry, so I feel the financial stress as well.
Thank you. Okay, Curtis Jordan is next to speak. Mr. Jordan?
Good afternoon. Curtis Jordan, 5617 Villa Drive, 79412, Lubbock, Texas.
Thank you.
I'm going to be brief also. David pretty much expressed our concerns. We certainly in the restaurant business, I represent the Jordan Restaurant Group. We own Teddy Jack's, Ike's, Cabooses, Cujo's. And we, between us, we're we're small. If you look at the whole city and how many employees are going to be released because of a shutdown with the restaurants, or to an extreme degree, there's going to be tens of thousands of jobs lost, and that is one of my big concerns, and hopefully the council will consider the job loss if we go too far with this thing. Thank you.
Thank you, Mr. Jordan. Our final citizen that has signed up to speak is Raymond Rios. Mr. Rios. Good evening.
Hello. I'm Raymond Rios. I live at 1104 42nd Street, 79412 here in Lubbock, Texas. I would just like to talk a little bit about how we got here. So on February 17th, there in the military base in San Antonio, we received some cases from China, from Japan, from the boat that was there on the shore there. We received them to our military base there in San Antonio, and the health and human service workers that were there in contact with those people were not properly trained, and they did not have the proper personnel protective equipment that they were supposed to be using to in contact with these people. On top of that, they were not tested themselves, and they were allowed to take commercial flights home. So they left from San Antonio, the airport there. Thousands and thousands of people go in and out every day. That was on the 17th, where they took those people. 10 days later was when the whistleblower came out on the 27th. So that means for over a month now, the coronavirus could be circulating throughout our communities here in Texas. So I know we've been boasting here in Lubbock about not having any confirmed cases, and much like the administration that leads our country now was initially boasting about low numbers and low coronavirus cases, and that was because the numbers are artificially low, right? The CDC wasn't allowing testing because of certain travel requirements that were needed to be tested, right? You could have fever, you could have the cough, you could have the aches, the chills, but if you did not have, you could even have, problems with your lungs, hard of breathing. But if you did not have the travel requirement of going to China, to Italy, Iran, South Korea, some of these countries that were having this problem, then you were not allowed to be tested. And I fear that's what's going on here in Lubbock as well, boasting about not having any confirmed cases. Like the gentleman, a couple people before me said, that doesn't mean we have any at all. I personally have some family members this weekend that were using that, the fact that there's no confirmed cases, to go out and shop, to go out to eat, to go to the movies, places where there's large gatherings of people. And I think we should be acting proactively instead of reactively, just not waiting until there is a confirmed case to, shut the schools down, restaurants and businesses. If we do allow this to be, those things to happen and go forward, then we're going to have an overrun of the health service. We don't have tens of thousands of beds for the number of people that are going to need ventilators here in Lubbock. So I would just encourage you guys to act proactively instead of reactively. Thank you.
Thank you, Mr. Rios. Okay, that concludes citizen comments for this evening. We'll now move to item 2 on our agenda. Item 2 is for the mayor of the City of Lubbock to declare a declaration of disaster regarding the COVID-19 or coronavirus epidemic, to include a declaration regarding public and private gatherings. I'd like the city manager to brief us on this. I believe that we've distributed a number of copies to the folks that are in the gallery tonight. So, Mr. Atkinson, if you would walk us through this. I know there's 2 documents that are largely alike. I think you'll point to the one you're going to cover first.
Thank you, Mayor. Be glad to do that. City council members, audience members, the first document that we'll discuss is the one that is titled Declaration of Disaster. Declaration of Disaster. We'll pick up the second one here in just a moment. Mayor, City Council, item is brought to you today, recommended by your staff, and it's brought to you as a preemptive action. Would suggest, similar to what we discussed during the 3 o'clock press conference today, to consider this item not substantially different from what you see sometimes on the Gulf Coast when a hurricane is predicted to make landfall. Not differently than something we might do here if we have good solid forecasts and predictions of a blizzard or a multi-day snowstorm. Why do we take disaster declarations and consider them or recommend them as a preemptive action? Well, it's simple. It is to keep us in front of whatever situation is occurring. Certainly city staff, mayor, council, I think y'all as well have heard us say numerous times as we've dealt with snow or ice or anything, we don't want to be behind and we don't want to leave anything parked. Now, we're not talking about snow plows here, but the same logic. I want all resources to be available. Considering this disaster declaration does that. A disaster declaration also provides the eligibility for certain state and or federal resources if called. We are not calling for those at the moment. We have no need. However, with this declaration, we have step 1 done. The eligibility is there for those resources. That may be as simple as basic medical supplies. It could be something more significant, but this is step 1 to do that. I would also suggest that this is a measured process. We have worked this situation following our 3-step protocol since it started. We have taken additional actions today, additional actions tomorrow. We're building up the response. We're staying ahead of it. So we suggest this is measured. I want to talk just briefly about how the process works. Fortunately, we do not do these on any kind of a frequent basis. So we'll talk about the legal authority. Under state law, power is ascribed to the mayor, to the county judge, to the similar chief elected officials across the state to consider and issue a disaster declaration. The mayor does that on the mayor's authority. taking the counsel that they choose to take, and then making that action. That is the mayor's authority. That authority then lasts for 7 days. 7 days. The city council's role, the remainder of the governing body's role, is then to review, and if you agree, to ratify. By doing such, you then open and extend the declaration period. Your agenda is structured today to allow both steps to occur. Step 1, agenda item 2, is for the mayor to consider issuing this disaster declaration, including the restrictions on public and private gatherings. Should the mayor choose to do that, item 3 then is for the council to review and to consider ratifying. If you would turn with me to paragraph 10, I'll take you through some of the operative points of the declaration. Before I begin, Mayor, Council, certainly this is an item that your senior staff, your public safety professionals, Office of Emergency Management professionals, we've all worked on this. Most importantly, as we've said for weeks, this is a public health issue. This is a declaration involving a potential public health issue. So when we get into the numbers, those come from your public health authority. Public health authority in Texas is a statutory title. It carries with it very significant authority. Certainly these people are experts in public health, but when they serve as your public health authority, they assume a statutory authority above that. So we'll begin on paragraph number 10. Paragraph number 10, because of the risk of the rapid spread of the virus and the need to protect the most vulnerable members of the community, this declaration prohibits all indoor and outdoor public and private gatherings of 200 persons or more anywhere in the city of Lubbock. The final clause beginning at 5 p.m. on March 17, 2020. That is tomorrow. So if this is passed, the 200 limit is put in place and it goes into effect tomorrow at 5. So hold that, and in a moment I'll take you into some of the detail. Paragraph 11, for all other gatherings, strongly recommended that the citizens adhere to the social distance protocols established by the United States Centers for Disease Control and Prevention, commonly known as the CDC. The current CDC guidance was actually published last night. We got a hold of it about 9 o'clock local time, and that guidance right now is at 50.
Can I interrupt you for a minute,
Please
Mr.
do.
City Manager? So, I just checked. We left for our press conference early afternoon. The White House sent. I had communication from the White House and the Intergovernmental Affairs Group, who's we hear from. I know that there was some mention on the press conference of 10. The CDC's guidance is not 10; it's still 50. But if you read through it, there's a lot of movement in that, and they talk about you looking at your individual community. The president, also on the city website or on the White House website, published a 15 days to slow the spread. Nowhere, it does say in here, it's suggesting avoiding social gatherings in groups of more than 10 people. And these are suggestions, okay? That is not an edict by any means. And when you look at when you actually look at you don't see this page when you look at the CDC website. You see these 2 pages where, it mentions once again the more than 10. It's not the lead on that, and I don't want you to think we've got our head stuck in the ground. We had a discussion earlier today about referencing the CDC link to this, but it's changed several times just today. So just a little bit of background on where we are and why we're there. And you might elaborate on that a bit, but I think that's important background for our citizens.
Absolutely, Mayor. Thank you. That I did skip one item in my notes. When you go to the CDC site, and the current posted guidance of the 50, which again takes you through several different options that are not 50. Most important thing that's posted on that is that whatever restrictions are considered should be subject to your local public health authority. Those are those statutorily titled doctors, medical doctors that are here, and that of course is what we have done in preparing this document and bringing it to you. So I'll jump back on 11. Again, this is referencing back to the CDC. Excellent points have been made. We discussed during today's press conference. Many of our local businesses have changed their operations. They are self-regulating. They are practicing the social distancing, and they're to be congratulated for that. Absolutely. They are able to continue their functions, take care of their employees, provide their service, and do so in a manner that complies with all of the recommended guidelines. We congratulate that, and we encourage more of it. Nothing in the document before you today, the rest of which I'll go over shortly, in any way limits anybody from choosing as an individual or as a business to do more, to be more restrictive. It merely sets the upper limit, and the upper limit is what's enforceable by your local government. So, Mayor, thank you for bringing that to account, and again would remind all of those tie back to the guidance of your local public health authority, which is where we are again today. Paragraph 12 talks about high-risk populations. Later in the document it is defined. I believe many of us either saw or have since read the information from Governor Abbott's press conference. The state has made mandatory certain restrictions as it relates to high-risk populations. So think of senior care facilities, think of hospitals, state schools, things like that. We also connect and tie back to it. I think for the discussion today, Council, would draw your attention to Section 13 and most specifically to letter C to start. I would like to go over briefly what is not a mass gathering, thus is not under that 200-person limit. The first is your Lubbock Preston Smith International Airport. As I noted earlier today, we are seeing self-regulation at the airport, year-over-year traffic. So we were fortunate we had Spring Break Sunday yesterday, and we can compare that to Spring Break Sunday a year ago. Airport traffic right now, outbound, is down about 55%. We're running just a little less than half of what we did a year ago. Obviously today's not done, so I don't have that number, but the throughput projections have us again at about 55–56% reduction. But nonetheless, your airport continues to function. Public or private schools, that is number 2. City, senior staff at the city, medical experts that work with us are in extremely close contact with our schools here. We will continue to be so. Actually, the schools have an entirely separate set of guidance that is coming out both from the state and from the federal government. We support their activities, and we stand ready to stand behind them, and we'll continue to do that. Note, excuse me, licensed daycare facilities are exempted. Places of worship, weddings and funerals, museums under the condition that it is a museum of the type that visitors are not generally within arm's length of one another for an extended period. That's back to the social distance. Number 7, spaces where 200 or more persons, so tying back to the same number, may be in transit or waiting for transit, such as bus stops. So in Lubbock, primarily think of our downtown transfer station. Its average daily traffic does not have 200 people there at one time, but if there were to be disruptions to the Greyhound system, it's possible. The next item, number 8, this does not prohibit the use of office space, hotels, or residential buildings. So in this one, think apartments. Number 9, grocery stores, shopping malls, outdoor markets, or other retail establishments where large numbers of people are present, but it is unusual for them to be within arm's length for an extended period of time. Number 10, hospitals, medical facilities and shelters. Now, those will likely come under some of the restrictions for high-risk population. And finally, jails and detention centers. So with those exceptions, this really is targeted at those true mass gatherings. 200 or more people and not meeting one of the below restrictions. If you're under the 200 people, you're not included. Certainly encouraged to adopt new business practices if you haven't already done so. Customers are encouraged to make their own choices. But this is designed to protect from where the science tells us the most likely issues are. Okay? I want to go now, if I could, to 13D. Questions have been asked. I think it's use of time to discuss. 13D, this does not prohibit the gathering of people in multiple but separate enclosed spaces in a single building. Think of a multiplex movie theater. But again, so long as 200 or more are not present in the single space at the same time. Several of our local theaters have begun to change their practices to ensure that this works there. Also, and this is simply for clarification, the declaration does not prohibit the use of the enclosed space if the 200 or more people are present at different times throughout the day. So in and out is not the issue. All together at the same time would be the issue. Item E, 13E, does define your high-risk populations. Paragraph 14 would note, again, we are still in the mayor's declaration, that the mayor may update these restrictions if it's necessary to respond to the evolving circumstance. So this is a start. There's nothing that tells us at the moment it needs to be more or less, but it absolutely accommodates the ability to change if change is warranted. Mayor, that describes in good detail, I believe, your declaration. Before I stop and take questions, if it's okay with you, I would like to speak briefly to number 3. This would be to the City Council. City Council, your document is entitled Resolution Confirming and Continuing the Mayor's Declaration of Disaster. Draw your attention to the last page. The functional difference in this document versus the document we are presenting to the mayor is item 17. Should the mayor issue the declaration and should the council then pass theirs, you are calling for this to be reviewed at your regularly scheduled meeting of April the 14th, 2020. So this is coming back. It will come back not later than April 14th, 2020. If situations change, it can be brought back sooner. If it's necessary to go past the 14th, we can go past April the 14th, but it will come back for your public review on that council meeting of April the 14th. With that, Mayor, I will pause. I would be pleased to take any questions you may have over your declaration of disaster.
Okay, thank you, Mr. Atkinson. I thought I might start with a couple comments and then open the dais for questions and comments along this. First of all, I want to make sure that I make something, I think, very clear I think I speak on behalf of the people on this dais, but there has not been boasting in our community about us not having any cases. We're reporting every day that we don't have any, but I don't think that's boasting. I think that's good communication. I saw a tweet this afternoon from the local media saying that we might be the largest city in the country without a case. I don't really think that matters. Okay, I think we're doing our best to communicate. And comparing us to the White House, who in my own opinion, took about 10 days to get out of politics and try to get into public health, I don't think is fair. And so, but anybody can choose what they want to believe. Our response has been, I believe, trying to put the public first. In making this declaration, I really have relied on the best advice that I could get from our city leadership, from our emergency management people, and most importantly, from our public health authority and our health department. Remember that as of yesterday in Texas, to my recollection, the most restrictive of these public policy or public gathering policies was 250 people. Now, those have tightened up some today as we see reaction, and it's not to say that ours won't change, but we feel like this is the best place to begin. And so here's some things that make me feel comfortable about this, the 200 number. There's a significant amount of collaboration between us as an organization and other large organizations in our city. Texas Tech is the largest, certainly, and that collaboration continues. And we talked all throughout the weekend, started early this morning, and they're continuing to give guidance, and they're in a place where in many cases they will send their employees home and work from home. You know, they've already encouraged students to not come back. They've done a lot, we think, to address this in the right manner. We've talked and will continue to talk with the school districts. They will make their own decision. Last week, when they decided, when they got to where they are today, they did that in consulting with our city leadership and our fire chief. Our two large hospitals are implementing significant changes to their visitation policies, including following the guidelines that I believe, if I've got this right, that the governor asked the Department of Health to put in place, which limits people that enter those facilities, and I believe will go as far as taking people's temperature before they come in. So we were trying to really not only limit who can come see patients, but anybody that comes in, whenever they come in. You don't get if you come in the morning and pass, you don't get a pass for all day. If you leave and come back, you're going to get a chance to get your temperature taken again. There are other things that they are putting in place as health systems. You'll hear about that soon, but they're very much of a partner in this, and they're accretive to the entire effort. We've had discussions with the nonprofit community. The utilities have been both local as well as those that serve us that have a national presence. They all are working to ease the transition to work from home and to be ready to be flexible and not pull someone's service if their situation is such that they lose a job or lose the number of hours, and that impacts their budget. And that's, some of these aren't always on the top of my list, but AT&T, Suddenlink, Atmos has been a leader in this, been a great partner with this action we take today. Will allow the city manager to work with LP&L to put them in that very same group. We've had a number of discussions with the business community. Some of those that are critical to our ongoing life, the way we get fed, and you'd be pleased with the work they've done. And it's important, and I talked about it in the press conference, and I'll mention it again today, but it's important that we take a deep breath and follow these guidelines that have been given. But when we go to the grocery store, that we don't buy more than a week's worth of items. If we'll do that, our grocery stores will get restocked this week. They will look like they normally do. We spent some time today with the local restaurant association and the Texas Restaurant Association, and I feel like that they believe that the stance we're taking is one that's prudent. They on their end are gonna step up and are doing a number of things to change the way they do business, including adding curbside service and more takeout and more delivery And then when someone does want to go in, they'll change that experience to try to capitalize on this social distancing and the like. So this is not something that I rolled out of bed this morning and said, okay, it's time to do this. And we've worked on this all weekend long, last week, and I feel comfortable with this, council. I would offer it up to you. I'm interested in your thoughts before I make this action and before we go to item 3. I'll open the dais. Mr. Mayor Pro Tem, would you like to start?
Thank you, Mayor. In reviewing the document, I just wanted to make one comment. And I agree on the timetable, first of all, that obviously we need to review it again. And that date is April 14th.
That is correct, sir.
Okay. Thank you, Mr. Atkinson. Yeah. I've been monitoring this situation, as obviously everyone has in this room, and it is serious. We do take this serious. It is not done lightly. We do not want to close Lubbock up. This is not what it's about. This is about being careful. The guidelines that the CDC has put in place, as the mayor said, I believe are correct. I'm not a medical professional, but I think that this is appropriate, in my opinion. Council, I really believe that this is appropriate. Thank you.
Thank you, Mayor. First, I want to thank the mayor and the staff, our health department staff, Ms. Wells. I know everybody's already spending an inordinate amount of time on this, and I support the declaration. I guess I would talk a little bit to the overreactors. If you look at how small our world has really become when you look at situations like this, and we're fortunate that we live in a world of data, and we have examples of communities that were in the world that were or where we are today, and they didn't take advantage of getting ahead of this like we are today. And you don't have to read very far about Italy to understand what they're dealing with. I am very sensitive to the small business piece of this. I own a company that I can guarantee you will already be adversely affected by decisions made as a result of this. So I'm sensitive to that. I think this council is sensitive to that. I'm like everyone else. I feel like I know everyone up here on the dais, but we won't sacrifice the public health of the citizens of Lubbock, Texas.
Mr. Chavez?
Thank you, Mayor. I'd also like to express my feelings about the safety and health of this community. This is what this document's all about. I feel for the restaurants. I understand your plight. I understand your concerns. It's a very well-drafted document. Everybody that participated in this, I thank you for your hard work and diligence. CDC has pretty much set the pace that we're supposed to take. And I think that pace has already been set. We're not here to contradict. We're here to make a statement. Again, safety and health of our community is at the top of the list. That's what we're supposed to be doing. And again, if it has an impact on the business, that's not what we're here to do. We're here to, again, safety and health of our community. Thank you, Mayor.
Thank you, Mr. Chavez.
Having just found my way back to the city, I was kind of out of the loop for several days now, been in the Metroplex welcoming a new addition to my family. And with that, I've been in the mix of some of the things that are being done in a larger city. So traveling to and from a health facility and having to go through some things that they have implemented, I know that it is real. I have a deep part of me that handles it in a different manner as well. But I think that this is the thing to do. I appreciate the fact that it still allows for some common sense or sensibility within this thing for individuals, groups, and whatever to make some additional decisions for safety. So I can support it, and glad to be home to see that we're looking out for the citizens here.
As I said earlier, Mayor, I'm probably the poster child for the high-risk group. And as we get more testing online, let's just be prepared for people to be they'll be positive. There's no question about it. You don't have to be a great math wizard to figure that out. It's just like a lot of other things. And in regards to my personal health and with the Lynch syndrome that I have, there's more visibility for Lynch syndrome and more testing is going on, so more people are being tested positive for Lynch syndrome. That's exactly what's going to happen here. I don't want us to overreact to when we start the ticking up of positive tests come. But we'll also have a lot of negative tests too, and you don't hear about that. In regards to my friends there in the restaurant business, I was in the restaurant business many years ago. And a friend of mine said, yeah, you know, those restaurants, you just don't know what's going to be, you know, the personnel in the kitchen, what they might be carrying. I said, I'm not worried about the kitchen. The people that are professionals in the restaurant business, they're going to make sure that their people in the back of the house are healthy, that they're going to make sure you probably ought to, you know, have a little thermometer, and every time that people come in that you make sure that they're not running a fever. But you don't have as much say about who walks in the front of your house. So I would encourage the folks that are in the restaurant industry to be proactive and maybe post some things in your restaurant, the entrance to your restaurant, some suggestions of if you have a fever, if you have this, you have that. Be proactive so if somebody comes in and they start coughing, you're going to do the same thing you would do if somebody had too many drinks. You'd probably send them home in a polite manner, but you would do that. So I think that was something that you guys could really have a profound impact on how we go forward and make sure that we have no reason to reduce this 200 to 150, 100, 75. I've always admired, and the Lubbock Restaurant Association has been a very good group, so I would hope that y'all would maybe put your heads together and do some of those things that people will see when they enter. Maybe there's even a card that you put on the table. I think that'd be a really great idea. The 200 to me, I can live with that. I think we're not overreacting. I think it's a reasonable number. But I would also hope that 200 would be a virtual sign to our population, our fellow citizens, to heed some of the things that we all need to do before there was even a coronavirus, and that's wash our hands, cover our face, don't go to work if you're sick. That drives me crazy when you have that. And so that's kind of in a nutshell what's popped in my head immediately. But once again, restaurateurs, show us the way. Show us how we can communicate the things that say, don't come in, we love to have you, get well, come back soon. And also, I've even had a couple of emails and text messages about, why are we even doing this at all? We've had no positive tests. Nobody's come up positive with corona. Well, that's an example, in my opinion, of that wonderful, strong West Texas independent spirit that we dearly love and that's ingrained in all of us. Let's put that on hold for a while. Let's do what's best for everybody and not demand that, I don't want to be like New York or L.A. or those places. Let's work together and make sure that I'd love for us to not have one positive test. But anyway, Mayor, that's my thoughts on initially right here.
Thank you, Mr. Christian. Council, I hereby issue a declaration of public health disaster as is portrayed in item 2 on our council agenda this evening. We'll now move to item 3. Item 3 is the resolution that accompanies the declaration. I believe that the city manager described this well, but I'll open the floor for comments or questions around this resolution if there are any further comments or questions.
Mr. Mayor,
Ms. Patterson Harris.
and I hope I didn't miss this, but I know that we've had press conferences last week and today.
Yes,
What
ma'am.
is the plan to continue to keep citizens advised?
I'm really glad you asked that question. I'll start and I'll let the city manager finish. We will continue to have a 3 o'clock press conference every Monday. Our city website is being updated beginning Friday. It's being updated with a daily report from the Lubbock Health Department. And all you need to do is to go to mylubbock.us. It's on the front page. You click right there, and that's the information. Was a weekly report, and now Ms. Wells and her team are updating that on a daily basis. In addition to that, that website has your links to your state and federal key resources. Also, our social media channels at the city are alive and well, trying to tell this story and to try to raise awareness among our citizens. And then finally, I think I'd be missing something if I didn't thank our local media. I think they've been very responsible and very thorough in the way they've told this story, and I'm really thankful for that. I think they've done a nice job with it. So that's how we're getting the word out. Mr. Atkinson, you want to add to that? I'm sure I've missed something, or 2 or 3 things.
Good summary. The one additional thing is every Friday, we will issue a wrap-up. Will come out through a press release. Generally, those will be, unfortunately, a little after 5 o'clock, but that lets all the testing deadlines pass. All the reporting deadlines will have passed, and we'll update as we go through that once a week. The second thing I would note, and certainly, absolutely, the local media has been phenomenal. Get your information from official sources, okay? Between the press conference ending a little after 3:30 today and me coming down for this meeting at 5, we dealt with a whole nother stack of, we heard this here. And I'll remind everyone what I said during the press conference earlier today. It needs to come from an official source, and the official sources by law have to report testing results. And if we ever do get to the point of a positive, we don't have the option of not reporting it. If there is a positive out there, it is not going to be obscured by a provider, by a testing lab, by the public health department. It can't be, and it won't. So please, if you can, check and use official sources for that information. And that rumors are inevitable, but they also take resources that has us not doing other things when that is going on. So with that, Mayor, I'll stop.
Ms. Patterson Harris, does that answer your questions?
That helps greatly, and I just appreciate the fact that it is ongoing, and will continue to be updated as information is provided.
Thank you. Mayor Pro Tem?
Mayor, I move to approve the resolution confirming and continuing the mayor's declaration of disaster.
Second.
Motion and a second to approve the resolution on item 3. Is there other discussion or comments? Mr. Chattis?
Thank you, Mayor. Yeah, just a comment. This morning, I walked into the grocery store just to kind of purchase what we normally do around for the week. I walked in, and it was a deja vu moment for me. I thought I was down in South Texas getting ready for a hurricane. The shelves were bare. I couldn't understand that. For whatever reason, I hope the people that are out there that are hoarding these supplies, I hope you have it within your heart to walk down the street and find the elderly that may for some reason or other not able to go out there and purchase whatever goods may be out there. Maybe you'll find it within your heart to share with your neighbor, the elderly. Again, there's a lot of people that are infirmed for whatever reason, can't go out in public and purchase, can't buy the essentials. Go knock on that door, go knock on your neighbor's door, see if they need a helping hand. Lubbock's known for that. Thank you, Mayor.
Thank you, Mr. Chattis. Further comments? All those in favor of the motion to approve the resolution that is item 3, please say aye.
Aye.
Opposed by that same sign. Motion carries 6-0. I believe that takes care of the business in front of us this evening. Ms. Garza, you good?
Yes, sir.
Mr. Weaver? Yes, sir. Council, thank you very much. Staff and citizens, thank you for being here. It's 5:53. It's a great day in Lubbock, Texas. We're adjourned.